Hello, I am is I am speaking Dr. Deshbandhu Vajpayee from Kanak Polytherapy Clinic and Research Center, 67/70 Bhusa Toli Road, Bartan Bazar, Kanpur, India. And today is Sunday, so this broadcast is especially done for the entire global public who understand English language, and therefore, as a summarize all the 6 days broadcast which we have done already in Hindi language. So we are summarizing here what we have expressed in a week. So now we start with the diabetes, which is a widespread and a very crucial disease condition. But before that, starting to that, I will tell you about the pulse reading, which is an essential part of the Ayurvedic practice. So now everybody should understand what is the pulse reading in Ayurveda. So now I start with this program with the pulse reading. Later you will get information about diabetes and then Alzheimer's, then malarial fever and what to do in view of Ayurveda. So now first I start with the pulse reading. So pulse reading is an essential part of the practice of Ayurveda medical science. And in Ayurveda, it is directed that pulse reading or pulse examination provides a lead to Ayurvedic Vaidya for correct diagnosis of the dosha, which tends to correct selection of remedy for a sick individual. Besides these, the pulse examination tends to physician to know about the prakriti and deviated dosage, which are basically three numbers each, and early description of pulse reading or pulse examination is not mentioned in the classical works of Charak Samhita or Sushrut Samhita. The first mention of the pulse reading is seen in the classical work of Bhav Mishra, who have written the book Bhav Prakash. In this book, a very short description of the pulse reading and pulse examination is given. It is not in detail, only few lines in Sanskrit language is given mentioning the methods of examination in very short. It is presumed that Bhav Prakash is composed and written by Bhav Mishra round about 700 to 800 years back, in between 1200 to 1300 century. That means pulse reading was a part of Ayurvedic practice, developed slowly and gradually round about 1000 years back. Prior to Bhav Prakash, no other writer or composer of Ayurveda texts have mentioned pulse reading. Therefore, it shows that pulse reading should not be said that it is as old as Ayurveda. In my opinion, it should be maximum 1200 years old and should not be more than that. As I guess and thus conceive the idea of pulse reading, that how Ayurvedicians of that time perceived the idea of pulse reading, the answer could be in this way that in olden time Ayurvedicians were related to astrology and practicing Ayurveda both. Process of Ayurvedic style of radial pulse examination. First finger denotes to Vata, second finger to Pitta, and third finger to Kapha dosh. A special group of studious persons were involved in the preaching, teaching, and healing areas. It is believed that the group transfers their knowledge by Shruti, listening, and Smriti, memorizing, and by repetition of slokas methods. Later, when script becomes in existence, then the knowledge transferred to written words. The practitioners of Ayurveda were involved in astrological works besides the healing job. In astrology, it is mentioned in horoscope of a person that which nali he is belonging. The nali is in astrology is mentioned Adi, Madhya and Ant. The three nali is matched by the astrologer at the time of marriage. The male nali or female nali should not be same. If male nali and female nali is same, similar and equal, then this is called nali dosha. Astrologers believe that same nali dosha couples may not be able to conceive and thus cannot born any baby or child. Due to this reason, nali dosha have an important features in the marriages due to astrological studies. So it is presumed that radial pulse examination was the easy way to confirm about the life or death of a person. Even today, every person check the radial pulse for confirmation of life or death instead of respiration. We see every day when we ask a person whether he have fever or not, the person will immediately check his radial pulse by keeping palm grip of fingers, tying radial arm around by hand or by one or two or three or four fingers to acknowledge the throbbing of the pulse. It seems that Nali dosha concept of astrology converted into Nali Tridosha. The practitioners of Ayurveda tried to grasp the Tridosha findings in this simple way by matching the similarity of person's constitution, prakriti, etc. because description of dosha was already given in the classical works of Ayurveda. After long-term experimenting, matching with the theory of Ayurveda fundamentals, dosha, Ayurvedicians established their observations in regards to pulse reading and its rhythm, speed and motion. The correlation of pulse rhythm with the motion and walk of the certain creatures and animals are given to the open observation to learn pulse reading more easy to understand. So, in the latest version and the latest invention is done in the field of Ayurveda for determination of Ayurvedic fundamentals. So recognition of Ayurvedic fundamentals is very essential for Ayurvedic treatment purposes. It is not very easy to establish the Prakriti and Tridosha of a sick individual by pulse examination for an Ayurvedician. The latest invention is electrotridosography, ETG Ayurveda scan, which provides data of Ayurvedic fundamentals in written sheets and report form, including the features of Nadi Pariksha. So, this is the latest invention of Ayurveda and should be taken in this way, in a very innovative way. Now, this is completed and this was all about the pulse reading which is done by the Ayurvedicians in general practice. So now I come to diabetes. Uh, Now about diabetes, I want to tell my observations which I have found. In our clinic, large numbers of the patients who are suffering from diabetes visited daily from the remote areas and cities. Most of the patients are referred by the patients already treatment taken and cured, relieved or going under treatment. For diabetes patients, we first advise to go for the electrotridosography, ETG Ayurveda scan examination, and then we stress and watch the problems of the patient from which they are suffering by evaluating their organs capacity. We observe The intensity of the Tirdosa and other fundamentals of Ayurveda essentials for the selection of appropriate Ayurvedic medicine and drugs. As you know that Ayurveda is based on its own principles, who are totally differ with the concept of modern Western medicine, say allopathy. The strategy of the treatment is also differing with this concept. ETG Ayurveda scan report shows the cardinal findings of the patient's body, the privilege of the diagnosis of the disease condition with the tracings of the ETG is very prominent. Tracer recorded from the epigastrium region shows very close differences with the presence of sugar level estimation approximately and not exactly as counted by the glucometer. The electrical scan shows the level of the glucose in blood. The waves B, C, D, E, S, H are counted both horizontally and vertically, clockwise or anti-clockwise, bending peripheral to center or center to peripheral, and other observations are taken into consideration. About this, we have already given in some video prepared especially in the same line. So you must go to see and listen the video which are related with these technical points. We say to patient with confidence that he is having high blood sugar level tendency or low sugar level tendency and count the level of the estimates by counting the spaces of the traces. Suppose we count that the patient should have sugar level about 300 milligram per dilution roundabout. When we examine the blood by the help of glucometer, it counts 348 milligram per dilution. So we have advantage to examine scientifically patient with a system which provides us a complete data, disease tendency, disease diagnosis and other features related with the patient health. On the collected data, we select the nearest choice of remedy for patient and time to time monitor the condition by follow-up ETG scan, which is essential for change of prescription and to avoid unnecessary heavy medication to patient. This is the most scientific way of treating diabetes patients of all nature by Ayurvedic medicines, which we do in our clinic. We have observed by this way patient got relief with their complaints and syndromes very quickly and definitely. So this is our observation about the diabetes, and after the treatment of diabetic patient we have got the observation and our experiences. So now much more about the diabetes. So diabetes, which is called prameya or madhumeya in Ayurveda have perfect treatment of this disease condition. Removal of the cause and causative factors, this disease can be cured or the severity of the diabetic syndromes can be minimized at a comfortable level. ETG Ayurveda scan and its supplementary tests and examinations, including Ayurveda blood examinations and Ayurveda urine examinations and test results after finding basis conclusion when diabetic patient is treated, then the problem is surely recovered. Before 5 years back, one post we have research results conclusion in relation to diabetes disorders by our institution. A report was published in some magazines and in which it is mentioned that cumulative pathophysiology of the body organs cause and generate diabetes disorders. Now in this research work we have mentioned that it is the conclusion which is mentioned. Number one, the only and solely pancreas is not responsible for causing diabetes, and diabetes is a cumulative disorder of the involvement of the liver and small intestines, large intestines, spleen, and kidney are also co-responsible to cause and generate the problem. So So diabetes is a cumulative disorder of the involvement of the liver, small intestine, large intestine, spleen, and kidney are also co-responsible to cause and generate the problem. So we have concluded it, and the medical fraternity all along considered these findings of the report conclusion as a joke and in fun. When we have done this uh, research work paper published, and the medical fraternity and medical doctors have taken it uh, in a very light way, our findings, and they make a joke of it that it is a kind of a fun, and I should not do this kind of research work, or any observations should be published which are not acceptable. So that was the physicians make a mockery of my observations, and I have never uh, comments on that one. So after publication of the findings done by our efforts, Japanese scientists declared after 1.5 years later that in diabetic problems, liver can cause, and in treatment, liver should be considered in producing disorders. So it was a victory for me, for my observation, that Japanese physicians have our findings came in reality and true after findings of Japanese scientists. So now it was my findings was stamped by the Japanese physicians and Japanese researchers. So after that, after finding of the Japanese researchers, after 1 year of these Japanese findings, the British scientists declared that small intestine is also responsible for creating diabetes. So our findings got an extra merit by the declaration of British scientists. After these two research, Australian scientists declared that large intestine is also responsible to produce diabetes. So when these findings came in existence by the route of scientists and scientific evidences, this stamped and recognized our findings, which was at one time a fun for the doctors. So according to Ayurveda, diabetes is generated by kapha dosha. Therefore, kapha dosha should be treated accordingly. The anti-kapha herbs are recommended for intake to treat the kapha dosha. Ayurveda recommends for treatment of kapha dosha those substances which are kadwa and kasela and charpura, bitter and pungent foods and herbs in taste, Karela and neem and kali mirch and choti people and sont and amla and bahela and haral and akarkara and kutki and shilajit and bhrangraj and others like herbs are having curing properties for diabetes, which are all found in India and Indian origin. Ayurveda newly developed high-tech ETG Ayurveda scan and its supplementary test and examination basis findings after Ayurveda Ayush treatment certainly cures diabetes and its related all syndromes, whatever they may be. So this is our findings, and we have given in our paper. So that actually a reality in our favor. So now this is all about the diabetes, and now I am giving you some uh, throwing lights in urinary tract infection, that is known as the UTI. So in the UTI is a curable disease condition by Ayurveda and Ayush treatment. So if anybody will adopt the Ayurveda and Homeopathy and Unani treatment, so certainly this disease condition can be cured by the by these therapies. So now I am giving you a short description of the urinary tract infection, and now this is a condition. This is an infective conditions involving the kidneys, ureters, bladder or urethra. So all the structures which are involved in urinary system, so these are involved in the urinary tract infection. So urinary tract actually infected by the infection uh, which may be of any origin. So the kidneys are a pair of small organs that lie on the either side of the spine at about waist level. So they have several important functions in the body, including removing waste and excess water from the blood and eliminating them as urine. So this reduces the blood pressure and electrolyte balance, and diabetes and hypertension causes the damage to these organs. These now two ureters are the narrow tubes of 10 inches, which is involved with this uh, in between the bladder and kidney. So bladder is a small sac-like organ that collects and stores urine, and the urethra is a small tube connecting the bladder with the outside of the body, so to expel the urine. So now it is divided in the two parts, that upper urinary tract infection and lower urinary tract infection. So upper urinary tract is composed of the kidneys and ureters. So infection in the upper urinary tract generally affect the kidney, and it could be a pyelonephritis and causes fever, chills, nausea, vomiting, and other severe symptoms. The lower urinary tract consists of the bladder and the urethra. Infection in the lower urinary tract can affect the urethra, and it causes a urethritis or cystitis that is related with the bladder. So these are the two conditions, so which is related with the urinary tract infections, and this infection is very common in the adult man rather than compared to children, and 1 or 2% children are affected with this disease condition, and adults are generally suffered with this disease conditions more prominent. So this is a Escherichia coli infection related. 90% are cases generally infected by Escherichia coli, and therefore this should be controlled by any way. Uh, this is a curable disease condition, and is not, if not treated well, then it can be a very serious one. So one must understand that urinary tract infection should be controlled by any way and in any condition. Now I am coming to malaria. So malaria actually a parasitic disease condition, and now know about the malaria. Malaria is a serious, life-threatening and sometimes fatal disease condition, which is caused by the mosquito biting and producing after that the parasites. So malaria is a significant health risk in every country and every tropical country. So this is actually the Anopheles mosquito who carries the parasites, and where the parasite start its life cycle, then it happens. The parasite Plasmodium has multiple subspecies, each causing a different severity of symptoms and responding to different treatments. So malaria can be prevented by the some use and changing the lifestyle. Otherwise, it is a very serious disease condition and can be fatal if not treated well. So it has an incubation period, a certain incubation period. So If anybody is suffering with this disease condition, and particularly if not treated well by the use of allopathic drugs and is still repeating the same fever and is not going on, then one must try Ayurvedic and Ayush treatment. So after Ayush and Ayurvedic treatment, the malaria is curable and its severity can be limited by using these remedies. So this is all about the malaria, and now I am coming to Alzheimer's disease condition. So Alzheimer is a very slowly progressive disease condition which is related with the brain, and the most common cause is the dementia, and the characteristic symptoms and stages of Alzheimer's are included problems with performing familiar tasks. The second one is difficulty in writing or speaking. The third one is loss of orientation to time and place. The fourth one is losing or misplacing items. And the mood or behavior changes accordingly, loss of interest in daily activities, and poor judgment. So, if anybody is having these all conditions, then he should be he should be understood that he is suffering. He could be suffering. He could be suffered with the uh, Alzheimer disease condition, and symptoms may be present in varying degree of severity. Any symptoms can be in aggravated condition, and the other can be in a less degree. So uh, the fact is that Alzheimer disease condition is not known. Actually, it is a accumulation of the protein amyloid in the brain is suspected to play a role, but it is not established yet. It is suspected. So uh, the diagnosis is difficult, slow progressive, because it is Alzheimer is a slow progressive disease of the brain that is characterized by impairment of memory, eventually by the disturbance in reasoning, planning, language, and perception. So, as I have already told you about this disease condition, but Ayurveda have a place of treating this disease condition. And if anybody is suffering with the Alzheimer disease condition, so Ayurveda Rasayana medicines are very effective. And if treated on the line of ETG Ayurveda scan findings, then Alzheimer disease can be treated well and with the best way. So, if Alzheimer patient is taking Ayurvedic treatment and Ayush treatment, including in the integrated way, so this disease condition can be controlled by the Ayurvedic drugs and Ayurvedic treatment. And now, lastly, I come to asthma. So now asthma with this disease condition, everyone is well aware to know what is the disease condition. So asthma signs and symptoms are developed as a result of the narrowing and inflammation of the airways. So this is the main way that when the airways is uh, narrowing and inflammation is present there, then this condition coming out. So symptoms are wheezing and shortness of breath and cough, and rapid respiration, sometimes which causes a very difficult condition, and the patient feels very nervous himself and life threatening. So there is different types of asthma and should be diagnosed accordingly. So allergic asthma and have some extrinsic and intrinsic factors. So Overall, the classical signs and symptoms of asthma are shortness of breath, cough, often worse at night, and wheezing, high-pitched whistling sound produced by turbulent airflow through narrow airways, typically with exhalation. Many patients also report chest tightness. It is important to note that these symptoms are episodic and individuals with asthma can go long period of time without any symptoms. Common triggers for asthmatic symptoms include exposure to allergens, exercise and viral infections, and tobacco also. So many of the symptoms and signs of asthma are non-specific and be seen in other conditions. So it should be segregated and diagnosed properly whether it is asthma or something else. Some associated symptoms are lightheadedness and chest discomfort, palpitation and fatigue, and lack of response to appropriate medications. So, physical examination and other examinations should be done for the correct diagnosis of asthma. And asthma is a curable disease condition if taken with the Ayurveda, homeopathy, and Unani system of medicine in integrated way. So this condition can be treated well by the Ayurveda and all these therapies if they are conjoined everyone and in a cumulative way. So we do treatment on the basis of ETG Ayurveda scan findings and Ayurveda blood and Ayurveda urine examination to find out the actual cause of the disease condition. Actually, this is a whole body examination process, and after going through the whole body examination, we find out the number one, the genesis of the disease condition, number two, the pathway, number three, the problem for which the patient came, and number four, extension of these all four. So actually we find out the genesis from the genesis and from the pathway and pathway towards to the main complaints for which the patient came here. So now we take, when patient came to us, we take it number three problem, and number four is the extension of number four the other syndromes, and we try to find out these two one, the genesis and the pathway. So ETG Ayurveda scan system gives us a true picture of the patient from where he is suffering and from which place the problem is triggering, and at that condition we treat all the four we treat it, number one, number two, number three, number four. We treated all four, which I have already described to you. So after treating this one, the every kind of disease condition can be controlled, or repaired, or cured, or relieved by this cumulative treatment of Ayurveda, homeopathy, and Unani. Now, I am keeping here. Uh, Now I am leaving the program, and will see you next Sunday at the same time. So thank you for watching, and thank you for your submission and your joining. So join us in next Sunday. Thank you very much.